You're good.
All right, thank you, Pat. Okay, let's call the September meeting of the Health Committee to order. Before we start, Rebecca, could you take attendance for us, please?
Sure, Mr. Chairman. Mr. Joyce,
Present.
Reedy,
Yeah.
Beston,
Here.
Huchet,
Here.
McLean Lane,
Here.
Miller,
Present.
Tunney,
Present.
Ward,
Present.
and Willingham.
Present.
All present, Mr. Chairman.
Great, thank you. Full house. Thank you, everybody. You'll have to bear with me a little bit here tonight because I'm having a little bit of issue with the Granicus app, but we'll proceed. I've got it back here under previous business. Can I get a motion to approve previous meeting minutes?
I'll make a motion, Mr. Chairman.
Second. Second.
I think I heard Mr. Beston and then followed by Mr. Ward for the second. All in favor?
Aye.
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 Unanimous. Number 2, authorizing an agreement with the Addictions Care Center of Albany Incorporated and amending the 2021 Department of Health budget. Is Dr. Giordano on tonight?
Yes, sir. Good evening, Mr. Chair. Thank you very much. As you recall, this is an item that the last 2 months I asked to be tabled, and we are here tonight to move forward. This briefly, we're asking permission to award an RFP that was issued to the community. The successful responder was the Addictions Care Center of Albany. They were the successful bidder because they offered a very comprehensive response, but they were also the only responder. It was sent out to over 20 local agencies who might have had some interest. I will say that this is the Addiction Care Center is stepping up in a situation where BOCES withdrew from their role as a prevention provider in the Cohoes School District last year. And what we were asking for was a prevention provider in the substance abuse world to not only work with the Cohoes School District, but the Green Island and Waterville School Districts. They have submitted a very comprehensive proposal. We have reviewed it very carefully. They're a longstanding partner and strong player in our community. It's in the amount of $147,369, and we're seeking authorization to award the RFP and enter into an agreement with them.
Thank you, Dr. Giordano. Any questions from the committee?
I do, Ray.
Go ahead, Mr. Miller.
Mr. Giordano, am I reading this correctly? This is just for the three Cohoes, Green Island, and Waterville?
Yes, the Addictions Care Center of Albany is already working in most of the other school districts, primarily in the Albany City School District. Mm-hmm. The void that was left when BOCES left in Cohoes from this line of business is now being filled by ACCA if this is approved, and we asked them to expand it as well to Waterville and Green Island. So this particular proposal is for those 3 school districts.
Do we have any other programs that serve other school districts in the county? Because this is obviously a countywide issue.
Absolutely. The ACCA is primarily in the Albany City School Districts. They've been there for many years, and they work with all the school districts in the county.
Okay.
This particular void. Yeah.
I'm sorry. So when you say Albany, I was thinking you meant Albany schools. You're talking about they're in the whole county.
They are, but they're primarily in the Albany City School District.
Okay.
Yes.
Okay.
So this would be an expansion for ACCA into these other 3 districts.
Okay. But there's nothing direct for places like Bern, Knox, and, Gilman, Ravenna.
ACCA on an annual basis offers their programs to every school district in the county. And any given year, an assortment of those school districts accept the offer. So they're very active throughout the county. But you're absolutely right. This is a countywide challenge.
No doubt. Yeah, as you know, probably know I'm a teacher, so I see it every day. And
yes, sir.
Sure doing what we can do to get those kids taken care of. So
yes, sir.
Okay, I appreciate it.
Thank you.
Thank you, Mr. Miller. Any other questions from the committee?
Mr. Chairman, I'd like to make a motion, please.
I'll second.
Motion made by Mr. Beston, second by Mr. Ward. All in favor?
Aye.
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 Any opposed? It's unanimous.
Thank you, Mr. Chairman.
Thank you, Dr. Giordano. Okay, under current business, establishing a menstrual equity policy for Albany County facilities and amending the 2021 Albany County budget. I believe this was sponsored, introduced by Ms. McLean Lane. Any questions from the committee?
Peter.
Mr. Chairman,
Go ahead, Mr. Miller.
That was Peter, sorry.
Oh, Mr. Tunney, go ahead.
Yeah, hi. For the sponsor, Ally, can you tell us what the cost of this would be? Okay.
Yes, absolutely. There's the appropriate restrooms, believe there were 318 or so. And at the cost of $248 each for the installation of just the dispenser. And then for the initial, annually about $5,000-$6,000 to stock. Let me just confirm that I didn't even put them in front of me, but this is of course I'm doing this from memory, which I shouldn't be doing because that's not very fair to you. Let me pull it up really quick here.
Ally, if I could interject, also
Yeah.
the financial impact statement is up on Granicus.
Oh, good.
Okay.
Oh, good. I've got mine up as well. Unfortunately, I apologize that my camera is not working. I'm working off my 10-year-old daughter's computer at the moment. Let's see. So it estimated cost of $1,000 to $5,000 annually, depending on the need, which we haven't quite established as yet. And the initial cost is $248 a piece. But then, it was just that initial installation. And then it's a pretty low cost for maintenance in comparison with, as I have found, when people have to leave work, unfortunately, and as I've discovered, there are little or no county facilities that are actually near a pharmacy, which I thought was surprising when I did a little research on this. So that's what we have currently.
Okay. And you mentioned the dispensing machine. That's to safeguard against, I assume, theft and whatnot. So.
Oh, yeah.
Okay.
It's what it does. It depends. It dispenses two different kinds, and they're locked up within it, and you have to press the button to get one at a time. There may be people that take more than one, but usually, when it comes to using the county restrooms, with the exception of where people have to wait for long periods of time, it's usually county employees.
Okay. Thank you, Mr. Chair.
Okay, I don't know if I heard another question there. Any other questions for Ally? Hearing none, can I get a motion to approve?
Yeah,
Mr.
Pat's got her hand up.
Who's got their hand up?
Mr. Chairman, I do. Patty Lockhart.
Oh, go ahead, Patty.
Yeah, I was kind of waiting for all the committee members to get a chance to ask first because I'm not on the committee. Thank you. Ally, I just wanted to know if you could give me a little bit history of how this came about. Is there been a problem in the workforce with this, or how did you come to see this as a
Actually,
need?
it started about in 2019. I had a study commissioned. Well, not commissioned. I should say that's a strong word, but it was regarding food deserts in the county, and you would be shocked by how many we have. And when those grocery stores get up and leave, usually they're accompanied by pharmacy, which gets up and leaves as well. And all of a sudden there was a dearth of, no access. I mean, if you go down to the South End, there's no pharmacy. If you go to 112 State, no pharmacy, that's gone. If you go to, let's see, out to Clarksville, there's no pharmacy that you have to go get in your car, go wherever it's parked, drive to wherever you need to go, come back. And I thought, you know what? Obviously I was a woman of childbearing age for a long time. And sadly at 50 still am, who knows why. And this is challenging, truth be told, getting up, leaving, having to go somewhere else. And then when the state introduced this, I said, there is kind of an answer here. And I did find some support within leadership on it, and some support with, some of the fellow women in the body. And I would rather it be available than people get up, leaving, being gone for 15, 20 minutes to get a product, then come back, then gonna have to go to the back, the whole thing, park in the parking garage, etc. This seems to me, obviously it's an initial cost that's not insignificant. However, this is also just a matter of fairness. We do provide toilet paper to people. Should we require people to just bring their own toilet paper? That's sort of how it came about.
Yeah, I was wondering how it evolved. You said that the state did some legislation in this regard as well?
Yes, the state now provides it within multiple arenas, in state facilities, et cetera. And it's proved a very successful program. And I personally have benefited from it, and have many of my colleagues that are there. And, it's also, it's just nice to not have to get up, leave, because.
No, as a woman, I totally get it.
Yeah.
I just was kind of curious as to how it all evolved. I mean, I was kind of like, oh, what's this? Has our employees been asking for it? Was there, where did it come from, this idea? But obviously you up at the state with the Assemblyman Stack and so forth, and they were dealing with it up there, probably also brought it to your attention.
Yeah, they brought it to school facilities, jail facilities, et cetera. And it's proved very successful in ensuring that people are not having to leave the facility to address this issue.
Great, thanks for the background on it. I just wasn't aware. Thank you.
Sure thing.
Thank you, Patty. Are there any other questions at this time?
I have my hand up.
I'm sorry, Wanda, go ahead.
Thank you. I'm still trying to figure out how my name got left off this. So just asking that my name added to it.
That is, I absolutely will make sure that you are on it. I hadn't even just circulated it yet, Wanda, and I apologize for my negligence on that.
It's okay, Dal. Thank you.
No other questions? I make a motion to.
Is there a, John, did you have a question?
Oh, sorry.
Me?
Mr. Do you have a question?
No, I'm good.
Oh,
I was gonna make a motion if we were ready. That's all.
I've got a question there.
Mark.
Chairman George.
Sure, Mr. Grimm, go ahead.
Yeah, thanks. The availability, it sounds like a great idea. The only question I have is being a free item, there's a tendency sometimes when something's free, people take them, beyond what their use might be. And as a result, then there's none available for some that might need them in emergency. Has there been any thought of saying having a nominal fee, so that would leave the availability there and also prevent maybe the abuse of free items available?
Ally, if I could step in here briefly?
Absolutely, of course.
Sure. I think the idea behind it was that we wouldn't expect people to take quarters with them to the bathroom for toilet paper. And in the same way, we wouldn't want to expect women to have to carry quarters on their person or dimes or whatever nominal fee you would choose in order to provide for their own health and well-being, which is obviously a natural thing. Also, there are dispensers that provide for delays in between pushes. You can't just automatically get 15. First off, it requires many pushes in order to get them. They're not the easiest things to use generally anyway, but there are specific machines that are within our price range that do provide for like a 30-second delay, a minute delay in between dispensing, so that you avoid that problem.
So no one would be able to just go in and grab a bunch from a basket, for example. They'd have to there'd be a
No,
delay on the, okay.
I suppose
thanks
if they
very-
wanted to invest quite a bit of time, they could, but it doesn't seem worth it for
Okay.
something that they could get elsewhere.
Thanks, Mr. Chairman.
And I concur with Majority Council. The machine that I use at the state, you press the button, you would have to wait a while to, and wait for it to come out. And then you have to wait again for somebody to do that. They would be, especially with the limits on individuals in restrooms currently, it would be very odd for that person to be in there that long. So no, I'm not laughing at your question. I'm just laughing at it would just seem strange if somebody was in there for 20 minutes.
Okay, thanks, Ellen.
All right, thank you. So do we have any other questions? Hearing none, I think Mr. Ward made a motion. Do I have a second?
Second.
Second by Mrs. Willingham. All in favor?
Aye.
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 Any opposed? Unanimous. Thank you. Number 4, public hearing on proposed local law number K for 2021, a local law to provide for the safe disposal of opioid medications. I believe this was scheduled
Chairman?
October 6th.
Mr. Chairman, this is tabled at the request of the sponsor, as is number 5, which is the local law itself.
Okay, thank you, Rebecca. Number 4 and 5 tabled by on the request of the sponsor. Number 6, authorizing an agreement with the Rehabilitation Support Services Incorporated regarding case management services for county reentry program and amending the 2021 Department of Mental Health budget.
Thank you, Mr. Chairman. This is a companion to what I brought to the committee last month, in which you authorized the renewal of an agreement with New York State to provide our reentry program. It's made up of 2 components. The Albany County Department of Mental Health administers the program, and a case management organization provides the in-community services. That for many years was Homeless and Travelers Aid. They requested to remove themselves from this initiative for reasons that were just organizational from their perspective. We put this out to RFP, which I think is a healthy thing to do anyway every few years. And we have a very successful or very comprehensive response from Rehabilitation Support Services to provide the case management services. It's in the amount of $125,000, and we ask your permission to award the RFP and enter into agreement with it.
Thank you, Doctor. Any questions from the committee?
Yes, I have one. I have my hand up. This is Wanda.
Go ahead.
Dr. Giordano, can you tell me how people are referred and how many people are seen, just an average?
Yes.
Okay, thank you.
Yes. So the process is initiated at the with the New York State Department of Correctional Services. They screen people, and there is a tool that assesses a risk for recidivism, and the first cut on this is people who are approaching parole, return back to the community, but for a variety of reasons determined by docs that they are at high risk for recidivism. Those individuals are offered participation in the reentry program in 19 counties around the state, including ours. It's entirely voluntary on their part. And then those people, when they get to they're paroled and return to the community. And if they elected to work with a reentry task force, we would then be sent the file, and we would begin working with them in that way. So the numbers, the last pre-COVID year in which we were serving the community, there were 287 returning citizens to Albany County that were served by the task force. During the last year, as you might imagine, those numbers were impacted by both the fact that there were fewer people paroled and that the parole office was closed for a good part of the year. So in the most previous year, we served 97 individuals. parole is open, discharges from the prisons are increasing, and we hope to resume that higher level of service to the community. For many, many years, we were above 250 people a year.
Can I ask if this is this a part of their or something that they must do in order to get out? I know
No.
there's, oh, okay.
It's entirely voluntary.
Okay.
They're explained what the benefit may be in terms of, connection to housing and help with getting a job and addressing mental health issues and addiction services. And I think you've been to one of our task force meetings. There's an enormous number of community stakeholders there to help. And many people who are getting out of prison, some of them who have been in prison for many years, elect to take part in this. So it's not something they have to do. It's something they elect to do.
Thank you so much.
Yes, ma'am.
Thank you, Ms. Willingham. Any other questions from the committee? Hearing none, any questions from any other legislators? Hearing none, get a motion to approve.
Motion.
Second.
Motion by Ms. Willingham.
Thank you, Mr. Chairman. Good night, everyone.
Thank you. Do we have a second?
Oh, I'm sorry.
Second.
Second by Mr. Ward and Mr. Miller. All in favor?
Aye.
Any opposed? Unanimous. Thank you, Dr. Giordano.
Thank you, sir. I didn't mean to jump the gun there.
Oh, you're good. Number 7, authorizing an agreement with Cornell Cooperative Extension to provide training courses for paint remediation.
Good evening.
Hey, how are you?
With a spoon. I'm good. Good evening. Dr. Whalen is at the Board of Health meeting, so I'll be representing the health department tonight. This is a request to contract with Cornell Cooperative Extension. This is a long-standing agreement that we've had with them every year. It is paid 100% from the Childhood Lead Poisoning Prevention Program. And what they do is they hold new and refresher renovation, repair, and painting training courses. We are asking to contract. This would be from October 1st, 2020 to September 30th, 2021. And the reason we are getting delayed contracts is the state is now getting to send out their contracts. So we will be having delayed contract requests. And this is a request for $26,500.
Okay, thank you, Ms. Witherspoon. Any questions from the committee?
I have one, Ray.
Mr. Miller, go ahead.
I think you already semi-addressed it, but so with the delayed contracts coming from the state, this is, even though it's delayed, this has already been in place. We've already had these programs for the year.
Correct. We've had this program for many, many years, and the state has already let us know, even though it was delayed, that this was coming. So we have already planned for it. The classes have already been taken care of. So we are just need the contract for payment.
All right, so just getting the money now. Gotcha.
Yes.
Okay, thank you.
Thank you, Mr. Miller. Any other questions from the committee? Any questions from any other legislator? Hearing none, can we get a motion to approve?
Motion.
Motion by Ms. Williams,
Second.
second by Ally McLean Lane. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 8, authorizing an agreement with the New York State Department of Health regarding the COVID-19 vaccine response program. Ms. Witherspoon?
This is additional funding that we received from the New York State Department of Health in order to boost the COVID vaccine vaccinations and also boosters. This is from January 1st, 2021. So it is retro, and it is until June 30th, 2024. And it is for things such as per diem staff, supplies such as masks, coolers, gloves, And the original amount, which is what is on the RLA, was for $338,857. And last week, we were notified after the approval of booster doses that the State Department of Health has awarded us an additional $539,000 on this contract. So we will be coming back again just so we can get approval for that extra funding.
Question.
Go ahead, Ms. Cunningham.
Okay, so I noticed in the, or I guess you could say in the original letter in August, it said that 20% was for racial and ethnic minority groups to increase accessibility. Was that also a part of the additional 500?
Yes.
So is it 20% of that also?
No, it seemed like, and I don't have the figure in front of me. I'm sorry. I don't have the new award letter. I jotted down some numbers, but it is not 20%. I'll get the figure for you.
Okay.
But total actually seemed to be a little less than 67,000. It was around 35,000. So it was updated and it was a little less.
Okay, I'm confused right now. Are you saying that the $67,000 that was in the August 9th letter has been reduced to half? Is that what you're saying?
I believe so. I don't have the letter in front of me, but I can get you the exact number. From my memory, I think it has been reduced to around 35,000, but just to be certain, I want to double check and I will give you that figure. But there is still an additional pot of money for us to go into neighborhoods where the COVID vaccination rates are below average.
Thank you.
Thank you, Ms. Willingham. Any other questions from the committee? Any questions from any other legislator? Hearing none, could I get a motion to approve?
Motion.
Motion by Ms. Willingham. Do I have a second?
Second.
Second by, I think that was Mr. Beston. All in favor?
Aye.
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 Any opposed? Unanimous. Thank you. Okay, number 9, amending resolution number 349 for 2019 as amended by resolution number 398 for 2020 regarding the maternal and infant community health collaborative.
So this would be the last extension from New York State Department of Health for our maternal and infant community health collaborative program, which is where our community health workers work with families to improve maternal and infant health outcomes. They do things like providing childbirth education, support, and also development of birth plans. This is going to be the last extension only because when we came to you guys last month for approval to apply for the newer grant, which is the Perinatal and Infant Community Health Collaboratives. So this is just to get us through until the new RFA is awarded. And that will start July 1st, 2023, once this last extension is completed. And this is from October 1st, 2021 to 6/30/2022 in the amount of $334,000. And this mostly goes to fund our community health workers, the program director, and the supervising community health worker 100% on the grant.
Sorry, I couldn't come off mute there. Any questions from the committee? Any questions from any other legislator? Hearing none, can we get a motion to move?
I'll make that
Make a
motion.
motion, Mr. Chairman.
Second.
Okay, we got a motion by Ms. McLean Lane and a second by Mr. Ward. All in favor?
Aye.
Aye.
Any opposed? It's unanimous. Thank you, Shauna. Pleasure. Get a motion to adjourn the meeting.
Motion.
Motion by Wanda,
Second.
second by Mr. Best in favor.
Aye.
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 Thank you, everybody. Have a good night.